Welcome, everyone. We're right at noon Eastern Time for our Ampath Fireside Chat. Global Health is Local Health. And with that, I'll invite our moderator, Dr. Adrienne Gardner, to join, and we'll get things kicked off today. Thanks.
Thanks so much, Deb. Welcome, everyone, to our monthly Ampath virtual Fireside Chat. We're really excited today to have some special guests about a really interesting conversation. Thank you all for joining us. I think many of you know, but I'm Adrienne Gardner, the Executive Director of the Ampath Consortium and Director of the Indiana University Center for Global Health. I'm joining you today from Indianapolis. You are likely familiar with Ampath and the fireside chats we hold in Kenya and now virtually over the last year or so, but a quick summary for those who may not be. So Ampath is the academic model providing access to healthcare. Our mission is really to improve the health of people in underserved communities. We do that through our partnership model of academic health centers and universities like Indiana University, Ministries of Health, and others to build and support public health sector health systems. The origin of Ampath goes back to 1989 when Dr. Bob Einterz, who's joining us today, began a collaboration between the IU School of Medicine and Kenya's second public medical school that was just forming at Moi University in Eldoret, Kenya. Bob spent a year in Eldoret with his young family in 1990, and since then, IU has had a constant presence in Western Kenya, building the partnership through the HIV crisis, civil war and unrest, and now the COVID-19 pandemic. Ampath's programs now serve a population of over 8 million Kenyans in the western part of the country, with key areas including HIV and tuberculosis, cancer, maternal and child health, non-communicable diseases, specialized surgery, and economic empowerment through our population health approach. We try to address the social determinants of health. In addition to IU, about a dozen other universities in North America and Europe are part of our Ampath consortium and collaborate side by side with our Kenyan colleagues at Moi University and Moi Teaching and Referral Hospital. In over 32 years, Ampath has helped train more than 2,200 Kenyan and North American physicians and published more than 1,000 research articles. As you'll hear about later today, we're continuing to further Bob's vision of training care providers in Kenya and beyond through the Einterz Global Health Education Fund at Ampath and IU. We're already halfway there to endowing 15 medical exchange scholarships in honor of Bob and his wife, Leanne. So with that, let me invite our presenters today to join us, Dr. Bob Einterz and Jesse Spencer. Many of you know Jesse Spencer, actor and Ampath advocate, will be our host today, interviewing his friend, Dr. Bob Einterz. Jesse is an Australian actor and musician who currently stars as Lieutenant Matthew Casey in the NBC drama Chicago Fire. He's known for his roles on the medical drama House and Australian soap opera Neighbours, and he's co-starred in several films and also plays the violin with the music group Band from TV. As many of you know, Bob is one of the founders of Ampath and was the founding director of the IU Center for Global Health. He also served as the Donald E. Brown Professor of Global Health and Associate Dean for Global Health for IU School of Medicine. In February of 2020, Bob began a new role as the Health Officer for St. Joseph County in Northern Indiana, and that's really the topic of our discussion today. So after their conversation, we'll open up the discussion, so please send in your questions in the Q&A box at any time. And Bob and Jesse, thanks so much for joining us today. I'll turn it over to you.
Thanks, Adrian. G'day, Bob. How are you, mate?
Hey, great, Jesse. Good to see you.
Good to see you too. Well, I thought I'd just start this off by saying how I came to know about Ampath. Do you know what I mean? How I came to be, into this program, because it's been now 15 years. So I thought I'd just tell the audience a little bit about how I actually got involved here. So in 2005, we have a mutual friend, Dr. Erica Kaufman-West, and she was doing her residency at Cedars-Sinai. And she had begged you to go on a trip to Kenya, right? In 2000, was it 2006 or 2005? I'm not quite sure.
Yeah, well, I can't remember, but you're right. She was very interested in participating in the program there in Kenya.
Yeah, and then she came back and wanted to do a fundraiser for Ampath. So she enlisted me as the host, and we did this fundraiser in an LA hotel. And we did, were you there? I can't even remember. It's that long ago. You were, right?
I was there. I don't remember you. I do remember the woman walking down the catwalk, though.
Yeah, because we had a runway and we had another mutual friend made all these outfits, and we sort of did this a runway like model show, like to sell the dresses to raise money for Ampath. I remember that. And we didn't have any models, so we just enlisted all our friends to be, to be the models. And then we did a charity auction. And I mean, that's how I got to learn about Ampath, was through Erica, and then consequently we met. And I became more involved as the years went on. As Adrian said, when I joined Band from TV, Ampath immediately became my charity of choice, because with the money that we took in from playing with the band, every band member would have their own charity. So mine immediately was Ampath, and has been for, gosh, what is it now? 16 years. Isn't that crazy?
Yeah, it's been terrific. We really appreciate it. In fact, I remember seeing you in Florida. My daughter, who happens to be in the room with me right now, obviously much younger, was keen to, knew about Band from TV. I didn't know about it. And we went and it was in Miami, I think, was the second time that we met you. So. That's
right. I remember that. That was a fun gig. Our gigs are pretty ragtag, you know, it's a bunch of actors just up there raising money, having fun and raising money for their different causes. And then in 2015, I finally went to Kenya. We made it to Eldoret, so I got to see the program in action. We went to the Moi Teaching and Referral Hospital. We saw the program. We did some field work. We did the orphanages, and it was actually really great just to see the, you know, you hear about it, you're reading about it, but to see it actually in action in the field was such a, you know, it just, you know, deepened everything that was going on with the work that Ampath is doing. So that's just a quick overview of how I got in here. Our topic today is global health is local health. So let's start with that. What does that mean to you, Bob?
Well, before I do that, just let me thank you very much for participating in this conversation and for what you have done. And over the years, we really deeply grateful to you for that. Global health and local health. If we think of health, what determines health really is where one works, where one plays, where one prays or meditates. And it's these, if you will, these social determinants that to a large degree determine the health of an individual or of a community. Most of us, or many of us, early on, at least in our lives, and I can speak for me personally, in the days I wanted to become a physician, we thought that health was to a degree determined by what happened within a hospital and within an office between a doctor and a patient. But the determinants of health really are so much broader than that. And whether one is living in Kenya or France or in the United States, South Bend, St. Joseph County, where I am right now, so much of health is determined by where one works, where one grows up, where one plays, etc. And so much of what we encounter and much of the actions, many of the actions that we take to improve the health of an individual and a community do need to focus beyond the office, beyond the hospital, and really out in the community, addressing economic determinants, social determinants, political determinants, for better or for worse.
Right. This was one of the first things that I've learned about Ampath was the, I believe you call it back then, the holistic approach to health. It's not just about antivirals and getting them out to the public, you know, at a cheaper price. If they don't eat, the antivirals aren't going to work. So what's their employment? And then very quickly it becomes, not just between, you know, a person who's sick, it's about the whole community straight away. So what that takes me to Eldoret. When you first went to Eldoret, what was it like when you arrived?
Now it's,
And why Eldoret? I never actually asked that question.
well, I don't want to spend too much time because I think I could spend a whole hour talking about this. But why Eldoret? Well, there were 4 of us at the time who had had experience working globally, and we felt that experience had impacted to a large degree how we functioned as individuals and as individuals, professionals, and in our personal lives locally here back in the United States. And we wanted to try to create the same opportunity for other, particularly younger physicians, but also older faculty members to have a chance to engage in another culture and to grow personally and professionally. We looked around the world, the 4 of us looked around the world at places that might be willing to accept the talents that we had, which admittedly were quite limited, but we are all physicians. And there was this new medical school starting in Kenya. It was going to be Kenya's 2nd medical school. They were at the same time looking around the world for individuals and institutions that could support them. And so in many ways, it was a match made in heaven. So it was that relatively inauspicious beginning that then started this, what now has been a 32-year journey. They had no building for the medical school at the time. The medical school started in a technical institute. They had only a district hospital at the time. There was, of course, no oncologist, no cardiologist. There was HIV, but we really weren't talking about HIV so much at the time. So that's how it started. Virtually very, very limited mental health services as well.
Gosh, I mean, just picturing that, I'm like, what did you have? Did you have any string? Did you have any paper? Like, it sounds like you're in a field with a bunch of guys looking around at each other. How are we going to do this?
Yeah, I remember the charts. The charts at the time were all paper charts. Of course, here in the U.S. now, and fortunately in Kenya, things are all electronic or largely electronic. But at the time, it was sheets of paper and scraps of paper that we used a safety pin or a straight pin to just pin together and left there at the side of the bed. It was a big open room in the hospital. It was wanting.
That was meager beginnings. And then how has that changed then over time?
Oh,
it's going to be completely different. I mean, even when I was out there in 2015, it was, compared to what you're talking about now, it was completely different kettle of fish.
It's absolutely night and day. Our Kenyan colleagues, night and day, except for the Kenyan colleagues who were there back in 1990 were brilliant, and the ones leading the institution now are of course brilliant as well. Very passionate, very concerned about the health of their community and of their country. But this inaugural group of physicians back in 1990 were really keen to begin a different type of medical school that valued the patient-doctor experience in a hospital in the office, but also was very much outward focused and recognized this, if you will, these social determinants, that one has to be engaged in the community in order to really address or achieve, if you will, the health of to change the health of the public. And so it was a very forward-facing physician group and leadership group at the time, and under their vision, their leadership, it has progressed to what we see today, a very comprehensive system, both medically and, if you will, from a healthcare system more broadly, emphasizing again the social determinants of health that we've talked about.
Right. I've got to get back out there again. I want to see it again.
Well, I'm just curious. What when you were there, what did you see? What struck you?
I mean, I guess it just laid down the reality of, insurance and how much, relatively how much money they earn and how much insurance costs. They can't afford insurance, even $1 a day might be, out of the question. So just seeing, how many people there are to a bed, it's just very confronting. I came from, from medicine in Australia. My family are, GPs and specialists and stuff. I played one on TV, so I think that I know, but I don't know. I don't know much. But it's just always really interests me, like how a program like that, like Ampath did, had such, you're talking about the synchronicity of being in the right place at the right time.
Yeah.
And pulling together this holistic program that actually has been very successful. I mean, you've got to be proud of that. That doesn't happen every day, to get a program like that up and running and to actually affect change in a community, not just talk about it. It's not just, you're not just giving people money. It's teaching them how to fish, and then, and then they fish themselves. And then the back and forth from Indiana to Kenya with, the exchange of knowledge, and actually it actually goes somewhere. That was the thing that really, I think, struck me the most about being there.
What struck me most about your visit, candidly, or as what I recall most about your visit, was you and Sylvia McNair sitting on a cliff overlooking the extension of the Rift Valley.
Bring this up.
Playing The Devil Went Down to Georgia. It was the most remarkable concert I think that I've ever seen.
It was all a cappella. We sang the whole thing. I don't know if anyone's ever done that. I remember that. Oh, that was quite funny.
But what really has made this partnership, I think, successful is first and foremost a willingness on the part of our Kenyan colleagues to accept us there in their space, obviously their space, and we were there under their direction, under their leadership, but they were willing to accept us there. And then it was an openness to experience each other's cultures. And it's not that what we do here in the United States is right or wrong, or what we do in Kenya or what the Kenyans do is right or wrong. It's rather to be able to have that experience of going there, being immersed in that culture, going there without any judgment, or if you will, trying to just avoid any judgment, but really try to understand, soak it in, be in the moment, and then begin to understand what really works well here. What works, for the Kenyans coming to the United States, what works well here in the United States that we could bring back to Kenya? And by the same token, what doesn't work well here in the United States? And what are we doing in Kenya that actually is better? And for the Americans as well, for us to go there, there are lessons learned if we're open to them. And
Right.
it makes us better.
There was a bit of trial and error with that too, wasn't there? You'd have to be like, well, let's try this.
One has to, I think, always, if one's ego gets too far out in front of one, then we get in trouble. We have to be willing to recognize that we make mistakes. We have to be willing to then change direction, and
Right.
that's not hard for many of us. It's part of the human genome.
Yeah. Do no harm comes to mind.
Well, as you know, having been the physician on TV and with your family, as the several physicians within your family, that is, of course, our mantra from the day that we go into medical school. And that pertains not just to an individual, but also to the community. And there was no question. And one of the things I always told my students, still for that matter, tell my students, residents, other faculty members, when you walk into a new environment, you perturb that environment. Now, the hope is that you perturb that environment in a way that will make it better, that you will become a better person, that they become a better community or whatever. And it doesn't matter whether it's me going to Kenya or if it's me going into the southern part of my county here. I perturb that environment just by my presence there. And I have to acknowledge and be aware of the multiple factors that are ongoing if I do wish to affect positive change.
Right. And that brings us, we didn't want to spend too much time on Ampath because we've got to move on to, you're a health officer for St. Joe County, huh?
Yeah, it's just a few county overs from where.
Let's bring it back to local health.
Okay.
Bob, I thought you retired.
Yeah.
Was there like a worldwide pandemic or something?
Well, you know, I actually took this job here. I planned to retire from Indiana University, mostly because I knew that Adrian Gardner was getting a little restless there in Kenya, was looking for a new job back here in the United States, and I wanted him to be in my seat there,
right.
Center for Global Health. He had all the right qualifications, and he's a hell of a lot smarter than I am. And so I figured if I stepped down from there, it'd leave that space vacant and he would see it. And indeed, that's exactly what happened. So kudos to the Dean of Indiana University for making the absolute right choice in taking Adrian on board. That said, I really wasn't ready to go out and just pick daisies. And so one of the Board of Health members here in St. Joe County, which is where my wife is from, it's South Bend, so Pete Buttigieg's hometown. So one of the board members heard me give a talk about Ampath down in Indianapolis just a year before I was going to retire, and asked if I would ever consider coming up here to St. Joe County. At the time, she said, you know, our Board of Health our Department of Health is moribund. It's got really poor morale, and you know, we're looking for a new leader. And I thought, well, why not give it a shot?
And when was this? Was this pre-pandemic?
Yeah, so I didn't take. I accepted the job in 2019.
Right.
I started the job on February 18th, 2020. The COVID pandemic was declared just a week or two after I started the job.
Oh, man. And gosh, I mean, this reminds me of the Ampath when you're in Kenya and then all of a sudden the HIV crisis hits.
Yeah. But you know, in many ways, this was not a challenge. In many ways, it was not a challenge, and at least not the way one might think, because this is going to sound a little arrogant. I don't mean it to, but we had a very, very successful, Kenyans and Americans working together, had one of the most successful HIV treatment and control programs in the entire world. For that matter, our models, the models that were coming out of Ampath, were informing Debbie Birx at that time, who was involved in HIV. Debbie Birx later became Trump's COVID czar, right? But before that, we were the ones informing Debbie Birx and her colleagues back in the United States of how one best manages the HIV pandemic and the parallels between the control of HIV pandemic and the control of COVID. I mean, there are many, many, many parallels there. And so to be stepping into this job at the time of a pandemic, a viral pandemic, I figured, well, it's just a repeat of what I've been doing for the last 30 years.
Perfectly suited to the job. So what do you think you brought back to Indiana and South Bend then?
Well, you know, you learn a lot in, I learned a lot through those 30 years. Fundamentally, the principles of HIV control and SARS-CoV-2 control are very similar. And in my mind, it starts with relationship building. We can't affect any change by ourselves. The change happens through the relationships that we develop with other people, be it in my own workplace here. My Department of Health has 50 individuals who, by the way, are not moribund, are terrific. I was really pleased to see that when I came on board here. They're just some real gems here. So developing relationships with them, developing relationships with individuals in the community, and that takes time. And for me, coming from out of town and in the middle of the pandemic, developing these relationships did become a priority for me, and unfortunately do take time.
Right.
And now I forgot your question.
Oh no, it was like what have you brought back to Indiana and South Carolina? And so it's relationship building was, I guess, the thing that you discovered that you found out in Kenya was it's the only way forward. It's the only way you're going to affect change, and that's what you have to do anywhere you go. So you come back to Indiana in the middle of a pandemic, and you've got to build these same strong relationships.
And it's
right?
not only that, but, if I, as a physician, having, have my titles and whatnot, if I walked onto your set,
I'd be like, get off the set, Bob.
Yeah, right. No, I mean, people wouldn't listen. Right. I mean, they wouldn't listen to me. I mean, they might, because you said, well, this guy maybe knows what he's talking about. But in reality, for me to engage or affect behavioral change in the community, it's never going to be me, or rarely will it be me. Rather, I need individuals from the community. I would need somebody from your set to really be the spokesperson, set the tone, and I'd need to work with them. And so this notion of using a community health worker or reaching out to opinion leaders, and this is, of course, is what we did in HIV and still do in HIV, identify who the opinion leaders are in any given community. Who are the leaders in that community? Who do the people respect? And it's in engaging them and them then engaging with the members of their community that I think we're most successful in affecting change in the community. And we've not been as successful as I wished we had been here in St. Joe County, or for that matter, across the United States. We know that immunization rates are still much lower than we would have hoped. But I do think that that's the avenue that we need to go down.
And what do you think the differences then in public health in Kenya versus the US, and what are the similarities?
Yeah, I think there are a lot more similarities than there are differences. Yeah. Some of the differences are the ones that you would expect. Average income, literacy, these sorts of things are quite different in general in the United States and in St. Joe County than what it is in Kenya. That said, in any given subpopulation, that does not necessarily hold true. But I think the similarities, though, are what we've been talking about, from the inception of this conversation that we've had. The most challenging aspect that I had in Kenya was Americans getting along with Americans. And I bring this back to St. Joe County as well. We within this, you're Australian, but we Americans very well, and you know that individualism is something that we value. All of us value it. Yeah. But unfortunately, when individualism comes up against the common good, it creates a fair amount of tension. Yeah. And I think we see that as well to a degree in Kenya, but not to the degree that we see it here in the United States. And so that makes it so much more challenging here in the United States to affect change within public health. Right.
Which would bring me to my next question, because my next one is, so we have a divide on mask wearing, on vaccinations, in the US, and not only the US, around the world too. You look around the world, it's not just here. I'm very sure about that. What does this tell us about public health and its role?
Well, first, I will answer that question, but I think to give it a little bit of context, maybe you could share with me what you have had to go through, experience, endure to continue your show.
So same thing. We wrapped at the end of February 2020, when I think that's when the whole world sort of shut down, and then we had 7 months off, and then coming back, we came back early in like October of that year. And I don't think we were definitely one of the first shows in the country, not the only show, but one of the first shows in the country to come back and start shooting with all new COVID protocols to keep people safe. Safety was the number one concern. And so they went pretty heavy with the protocols. We were tested every day. We got rapid tests every day. And then I think once or twice a week, also a PCR test. We had PPE protocols. It was masks, obviously, at all times. The crew also had to wear visors, which even outdoors, do you know what I mean? Which gets so you could watch, and the poor crew, because when you wear a mask, it's fine. It's actually not as claustrophobic to me as like wearing the SCBA that we wear for the oxygen when we go into fires. Like that's really claustrophobic. So a mask to me didn't really bother me. But the crew had to wear this visor on top, so they'd be getting headaches. Do you know what I mean? And they'd try different glasses and things, and even outdoors, which I was surprised. I thought we'd be safe not to wear a visor outdoor, maybe even a mask outdoor, but probably better to wear a mask. Obviously, trying to stay 6 feet away at all times and stuff. And it just made for a harder shoot. It just put everything into a totally different category that we knew was going to be difficult, and everyone did really well with it. We all were trying to respect these protocols and do the right thing. But man, I've had like over, I don't know, I should count how many tests I've had, how many swabs I've had on my nose, because when I talk to doctors, in hospitals and stuff, and they've been tested maybe a couple of times during the whole pandemic. I'm like, what? Why are they testing TV actors like hundreds of times, So it's been a lot, but we're on the forefront of television, and our model actually, because they were watching if we were successful or not, if we were able to pull this off, and then they'd replicate, our model of testing and COVID protocols for different shows around the United States. So
So just to be clear, though, it wasn't the health officer of the county then that was demanding all of this of you. It was the movie industry or the television industry?
Yeah, I believe it's the unions. I believe they were talking, I'd have to double check. I believe they were talking to, health officers, and no, in fact, I know they were. They just implemented the most stringent protocols that they could. Do you know what I mean?
Well, let me suggest to you that rather than having Chicago fire, you do South Bend fire the next year, because we're a little bit more relaxed.
Easier down there.
We were the first county in Indiana. We were the first county in Indiana to issue a mask mandate. So I did have a mask mandate that I issued in early May, but it was never for outdoors. It was just for enclosed spaces. But yeah, the divide that you talk about is really very unfortunate. It was very clear that this whole thing became politicized, and I like to say that health is politics, but I don't mean it for years I said, well, health is politics. Because so much of policy impacts health, but I never meant it in the way that unfortunately it unfolded over the last year. And so we did see that, and I certainly understand if I had to endure what you did and what your whole crew had to go through, I would likely be lashing out at every health officer.
It might have happened a couple of times. We felt like it was getting out of control, or it may or may not have happened a couple of times.
I'd like to say that over the course of the year here, I've successfully, excuse the language, pissed off, angered enough folks on the right and enough folks on the left that I figure I just must be doing the right thing. Seriously, to steer a middle ground through all this has been very, very challenging for me. I have this wonderful deputy health officer who was the face of our county. He was the one he's more photogenic than I am. And so he was the face of our Department of Health with the newspaper and with the media. he received a couple of death threats and a whole host of hate mail, which of course I've received as well.
Right.
And it's been hard. On the other hand, I think that there is a fairly significant silent majority that has more or less agreed with realistic measures that we've tried to implement. But again, when individuals perceive that their individual freedoms are being stomped on, they react in ways that I think if they took a step back, they'd be a little bit embarrassed about themselves.
Mm.
So,
It is what it is, Mark.
yeah.
And what's the media's relationship with this? Because I feel like sometimes there's a disconnect between getting information out to people, and then there's this other side of media that just becomes clickbait, that has or misconstrued, or is not exactly what it's not the information that you're actually trying to get out to people to affect change and help everybody.
Now I'll tell you a little story. You'll see behind me. You see behind me this picture of what's an acacia tree and a lone wildebeest. That was given to me by my wife after a certain episode happened where I was misquoted in the media. I'll share that with you. So the University of Notre Dame is here in St. Joe County, South Bend, and their students had organized an event out at one of the bars. And they notified, this was back in the day when we were supposed to be wearing masks all the time. And at any rate, they were concerned about their students and of course the impact that their students would have on the community. And so they notified me and asked me if there was to go and investigate. So I usually go to bed about 9:30 at night, which I did that night. At midnight, I got up, went down to the event, which was in one of the local bars. And it was the typical scene that you would expect of a mass of college students in a bar. And a newspaper reporter called me the next day and said, well, what were your first impressions? And I said, well, it reminded me of the great wildebeest migration. And he looked at me kind of puzzled. And I said, oh, you don't know about the great wildebeest migration? And he said, no. I said, well, let me share with you the great wildebeest migration. And I explained to him how the wildebeests are packed, hip to hip, toe to toe, nose to nose. Talked about it, and I think maybe you've seen the great wildebeest migration. The animals are grunting, and you're sitting there in this middle of this wildebeest migration, and the animals are all over you. These all sorts of sounds and not so pleasant odors as well. So I explained this to him. Well, the next day in the paper, it's Einterz health officer calls Notre Dame students wildebeest.
Oh no!
So I get a call then from the three commissioners of the county, chastise me for having
made an analogy.
Yeah, exactly.
Right.
And so I did though offer to make an apology to the noble GNU for having compared the noble GNU to a bunch of Notre Dame students, but I didn't.
Well, I mean that feels. I mean that stuff must happen all the time, and that's the stuff that sort of. I mean, is that really? It kind of gets in the way. You can take any quote and misconstrue it if you want. And I found it's become more and more prevalent, that sort of that sort of stuff, which is kind of sad. But we've got to. What are you going to do? You got to keep muscling on, don't you?
See, I probably should have called you and your publicist, because I don't have these folks around me.
Oh, I don't have a publicist.
You don't have a publicist?
No.
Oh, you're kidding.
I'm like lone wolf. I'm like the wildebeest that like ran away from the migration, and then like sometimes gets eaten by the lions. That's me.
That's you. So you must have had some episodes or sometimes when the press is interviewing you and. How do you manage it?
I'd have to think back. Yeah, I mean, there was curly stuff sometimes. I think I remember on House when they were asking about medicines. I can't even remember now. I mean, I've avoided it pretty much, I mean, my stuff's, I'm talking about TV shows, I'm not talking, we're talking about fictional characters. So there's only so much trouble you can really get into. But
well, I personally, I still believe to this day, the press is our friend. In general, I rely on the press to they're
the middleman, and they're the ones who get it out to the public. So
yeah,
it's not an easy role. Brings me to so countries are taking different approaches to COVID. I was interested in Sweden. Do you remember when they did this? We're not going to do anything.
Yeah.
During the pandemic. So what? And it seemed to look all right for a while.
Yeah.
And they asked citizens to be socially responsible.
Yeah.
As opposed to mandating laws and all that sort of stuff. So do you know how that went?
All I can say is I'm so glad that Adrian Gardner is on this Zoom call as well. He is now the director of the Center for Global Health. My focus has been on St. Joseph County.
Oh, okay. Well, I'll ask him later when he comes back on.
Yeah.
I wasn't sure if that was, okay.
I would love to see, I think it didn't go quite as well as they had hoped, but I will defer to the experts on this one.
Okay. Yeah. How long is COVID going to go on for? We've got the different variants, flare-ups, booster shots. It's a question. I feel like it might go on for a long, long time.
Yeah, I think that COVID is going to be with us. SARS-CoV-2, the virus, is going to be with us until I'm pushing up daisies, and probably beyond that. I do expect variants to arise. I think it's, we talk about how we've been so privileged here in the United States to have access to the vaccine, and yet so many individuals have not gotten the vaccine, and this simply becomes a breeding ground for the virus. We're going to continue to see mutations. We are already seeing an upswing within the last few weeks in incidence of the virus here in St. Joe County. Hospitalizations are again just starting to edge up, and again, though would love to have seen the herd immunity develop to the level that we had hoped that it would, I don't think we're going to see it quite as quickly as we would have hoped. So we're going to have to be on guard. And of course, this isn't going to be the last pandemic. It wasn't the first pandemic. This is part of who we are as a civilization, as human beings. We've been subject to pandemics since the time human beings evolved. And we're going to see it more. And I think with the global travel that does occur and has been happening and will continue to happen, we're going to see more pandemics in our lifetime.
Right. How much of America is vaccinated now? Is it like 60% or something?
It really depends. As a whole, I think it's still down in the between 50 and 60%. Here in St. Joe County of eligible population, we're at about just 53%. And yet there are 92 counties in the state of Indiana. We're ninth best in the state. But even in our county, in the southern portion of our county, which is more rural and more conservative, we're seeing vaccination rates of the eligible population down in the 20 to 30% range. It's very unfortunate as well in certain pockets within communities of color as well. We're still seeing lower rates of immunization. Yeah,
it's better than Australia. I think Australia's rate of vaccination is like 3%.
But you all closed off. I'm not sure I should say you all, since it wasn't you, but I
closed them off.
Yeah, the borders didn't.
They closed me off. They wouldn't let me.
They wanted to quarantine you for 14 days.
Yeah, I mean they effectively eliminated the virus from the continent.
Yeah,
and it's it's an island. It's an island continent. So all you have to do is quarantine everybody coming in. Which they did pretty effectively and eliminated the virus. However, because there were no no mandates, no masks. You can go to sporting events and concerts. So they're living there without the virus. If the virus does escape quarantine, they shut down immediately. They get 5 cases in like New South Wales, they shut the whole state down.
Yeah.
For like it's 2 weeks, and then they eliminate it, and then they come out. But then because the virus doesn't exist there, no one gets vaccinated.
Yeah. So let me ask you, for anyone listening and for all of my colleagues out in the town here who are vaccine hesitant and don't wish to wear masks, should I encourage them to become citizens of Australia?
They won't let you in, Bob.
Yeah.
They did. There was this one other interesting tidbit with Australia. They did come up with. Did you hear? I don't know if you heard about this. A vaccine, their own vaccine. The problem is they're trying to get the vaccine in, and Australia was kind of like last on the list because it's, I don't know, too far down under. I don't know. I think Italy got it first because they were having, more issues and more deaths and all that stuff. So they did develop a vaccine, and I should have looked this up before this interview, but that used the HIV virus.
Oh, really?
Yeah, as a vehicle to get the vaccine in, and it was perfectly effective. But unfortunately, people were testing positive for HIV, even though they didn't have HIV, right? I'm like, go Australia.
That sounds like misinformation.
Does it?
But again, Adrian's the director of global health. We'll have to.
Oh, yeah, we'll ask him about
He'll be the expert.
Yeah, dispel the myth. What have we got next? Okay, so what's the time now? We've got 11:46. Are you okay to keep going a bit longer?
Yeah, I mean, Adrian's here. He's
Dispel my disinformation, Adrian.
We do have some, we do have some really good questions in the chat. If we want to turn to those.
Sure, we can do that.
So appropriately enough, the first one comes from Erica. And I don't know if you guys remember, you guys may know it. I was actually the team leader, so I got to work with Erica for a month in 2000.
Oh, you did?
October 2006, back in Kenya. So it was a lot of fun.
She's great.
You've touched on this a bit, but I think it's worth exploring a little bit more. So how can we try and decouple public health from politics? Science tells us that good sex education, syringe exchange programs work, but there's so much political baggage with these. How can we get through the politics to help people? And I think this is a question probably for both of you, actually, because in some ways it's a civil society question as much as it is a medical question. I think.
Yeah, actually, Erica, I don't think you can decouple it. I really don't think you can decouple it. I think the question, which I don't have the answer for, unfortunately, is how do you better couple it with politics? I think that I can only speak from my own experience here in St. Joe County. We were reasonably successful here, certainly relative to other counties in Indiana. And one of the reasons I think we were successful here is that we formed what we call unified command, and we had a representative from of the elected representatives, a representative of the elected representatives, who happened to be a former mayor of Mishawaka, which is the sister city to South Bend here in the county. And he participated in these every other day discussions that we had. Actually, it was every day for a while. In the discussions we as health officer and the hospital systems had in trying to decide how best to make recommendations, or if you will, mandates for the health of the public. And so again, I think where I did fail, is not reaching out adequately enough early on to all of the elected officials. I think and part of that, of course, is I was new to the county and I just simply didn't know people. But I do think bringing people people of different stripes around the same table is the only way to do it, though we recognize that's difficult in some instances. And certainly at the federal level, the disconnect between the two parties is so very, very unfortunate. My hope is that behind closed doors, they're actually speaking to one another more than what we see in the media. What are your thoughts, Jesse?
I don't know. That's a big one. I'd always thought, I think you're right. I don't think you can completely decouple that. But if there was a way, I would like to see if it was possible, and I don't know if this would be possible either, but open debate. I think open debate would at least give a listening audience, the two sides that we see in college and universities, and you have open debate about subjects. And I don't think we really see that anymore. I haven't seen open debate. There's one side talking about something in the media and the other side talking about, and there's no like getting heads together and thrashing it out the old school way, which is by debate. So that's the way I'd like to see it done. But
a Lincoln Douglas style debate sounds interesting.
Yeah, exactly. Right.
Good point, really. So another question for you guys. COVID response has been challenging the world over. The pandemic has raged nearly everywhere. So from your perspective, what has contributed to the challenge in controlling COVID? And particularly, have the structural and social determinants of health been adequately addressed in line with the mission and values of Ampath? What can we do better going forward, both locally and globally?
Well, there's no question that health disparities and the root causes of those health disparities raise their ugly head here within the COVID epidemic. So really marked inequities in income, in education, in empowerment, in terms of political voice. While as long as these sorts of inequities exist, we're going to continue to see significant difficulties. And here I'm talking about particularly in the early goings of the pandemic. As we all recall, in the early goings of the pandemic, it was the communities of color who were most affected by this. Now, once the pandemic got rolling, it became a different story. One still needs to address the inequities, but the answer there gets back to the former question that we just had. Thoughts, Jesse?
No, I think that's your field.
Okay. And by the way, did you ever, and this will expose a little bit of my ignorance, so I hate to ask this question in a sense, but how did COVID actually play out on the set of Chicago Fire? And did you as a team do, if you will, your part to promote or prevent COVID?
Not really. The answer is not really. Funnily enough, a year before COVID hit, we did a pandemic in Chicago, but it was a necrotizing fasciitis. There was flesh-eating disease.
Sort of strep. Yeah.
It was like there was sort of like a zombie apocalypse sort of episode a year before the pandemic hit. But I think, it is mentioned, do you know what I mean, in the show, but I think mostly, our show is about escape. It's not, to tackle the world pandemic. I think people were dealing enough with that in real life. Do you know what I mean? They didn't want to see it on the screen. So they're watching shows like mine to escape that sort of thing. So we didn't, really address it very much. It was mentioned, and we would wear masks sometimes around people in the public and stuff. But it was more or less, we were like, this show's about, it's about escapism.
So does that mean that the cameo appearance by the St. Joseph County Health Officer is not on the docket?
Yeah, there's no pandemic. What are you talking about?
Go ahead, Adrian.
Maybe another way of approaching this question, but I think it's a really good one, is there seems to be a recognition that the U.S. has underinvested in public health, and there appears to be some funding coming to improve it. How do you think state and county health departments should spend such funds to have long-term impact on public health?
Yeah, here again, it's absolutely true that in the United States, funding on public health has been woefully inadequate. And there's so much we could be doing for the prevention and the control of multiple different conditions, not just COVID, but we look at issues related to mental illness, cancer. You name the disease, and there's more we could be doing within public health. That said, I again go back to this notion of developing relationships and reliance on individuals from the community with lived experience. And I think we need to invest more in these individuals, community health workers, for example. I feel very, very strongly that we should be doing more there. Obviously, much more we can be doing at a policy level as well, though as we have seen, that can be much more challenging. But locally, there's so much more we could be doing if we had more resources, and not just resources, but advocacy. I think we've seen, particularly with immunizations, that what a county health department can do and what it is capable of doing, and the power to prevent disease. And we need more advocacy by individuals in positions of power, the commissioners, the elected council, the president of the United States, the senators, the representatives, et cetera, waving the flag for public health. We can do better in this country than what we have done.
How's the vaccine rollout been? I felt like it was it's so easy to get the vaccine in this country.
Yeah. It's been one of our real successes. I have just a terrific team here within St. Joe County. And we were immunizing, the county is 270,000 people. And at one point, we were immunizing 1,200 people a day. It was just remarkable what my team has done. And this is no credit to me, but to the team that was out there. And we had our folks from the environmental unit and our nursing unit and just everyone joining in. We had a terrific showing on the part of our volunteers. We reached out to the community and asked for community volunteers. We ended up getting several thousand. 300 of them actually worked multiple times there at our vaccination center. So it was the silver lining of COVID is that it did, in a certain way, bring our community closer together. And that was good, and it did show the power of the health department.
Do you think it'd be better next time around, like for next pandemic?
I think where we weren't prepared at all was for the personal protective equipment, the PPE. We just didn't have enough. Hospitals didn't have it. We didn't have it. Nobody had it. And so for sure, we're going to be better prepared next time for that. And it was just short of miraculous, or maybe it was miraculous, that the vaccine was developed as quickly as it did. I think this gives we give credit to the former president and to the scientists and to the people that were willing to accept the vaccine. It was just truly miraculous that it evolved in such a short period of time.
Is that the quickest turnaround ever on a vaccine?
I believe by many, many years, the quickest turnaround. So next time, could it go even quicker? Don't know, given that it went as quickly as it did this time, but maybe so.
Right.
Hey, Bob, we have time for maybe one more question here. How do we improve or take lessons learned from the Ampath model of partnership, really, to improve, academic, government, private, and other partner, so private sector and other partner collaboration as we respond to the COVID-19 pandemic and moving forward, really, in addressing public health issues?
Well, the founding principle of Ampath was relationships based on mutual trust and mutual respect and aiming for mutual benefit. And so often I think we forget that in interactions with other people. And I think if we can take a step back and always think respect, trust, do what one can always do, not to break that trust, and to look for reasons, look for mutual benefit. I think that's really where things start and where things should end up, and no matter what we're doing. So that would be the biggest lesson that I've learned from Ampath, and it's a good life lesson. So
we'll start to wrap things up here, but thank you both so much for joining us today. Really fascinating conversation. Let me give you an opportunity so we can make some final concluding comments for the audience, either Bob or Jesse or both of you.
Well, I just want to say thank you for having me as host of the Fireside Chat. I've never done this before. I'm normally the one who's being interviewed. So this is different for me, but very interesting. And I learned a lot. Thanks for being so open, Bob. about what's going on in the world and how you're dealing with it. And I found this a very informative experience. I do want to say one thing before I go that I forgot to mention. I felt like the reason that the pandemic actually happened in the first place was because I started playing a board game in 2019. Have you ever seen this one?
No, I've not seen it.
I was playing this board game for about 6 months solid before the pandemic actually caused this whole pandemic. So in the end, I've got to burn this to the ground, man. Dang. It was really fun to play, but the real life, not so much.
Yeah, I'm with you on that. Real life, if we had our druthers, we wouldn't go through all this ever again. And I, on my part, of course, Jesse, would like to thank you and Callie for coming and visiting Ampath several years ago. It must have been 6 years ago now, and for your continued support. We deeply appreciate it, and I think you really do make a world of difference. So thank you so much to you, and please give Callie a big hug from us.
I'll do. Great. And thanks, Adrian, too.
No, thank you, Jesse, again, for being such an advocate for the program, and Bob, for all you're doing locally and globally. And thank everyone for joining in and tuning in today. Support from people like you has really allowed Ampath to grow and create a model of care serving those in need for over 30 years. So I do want to make sure that everyone knows that we currently have a matching opportunity to create permanent Ampath training scholarships in honor of Bob and his wife, Leanne, through Indiana University. So for every $2 you give, your gift will be increased by $1. And the link, I think, is in the chat to support Ampath and this Global Health Fund. Thanks to all of you who have already supported it. If you're interested in learning more about Ampath, please feel free to reach out to us, and we'll be in touch about our next fireside chat. And again, thank you all for joining us and for your partnership with Ampath.
Great.
Thanks so much.
Love
Take
it.
care.